Okay, so quick reminder, acid-base imbalance, right? So we're thinking about metabolic acidosis. Actually, let's get to here. I think that slide was premature. So we have to do ABGs first. How do we do ABGs? Through an artery. You draw blood. But how do you know that you're drawing it from the right place? What's that procedure? It starts with an A. Allen's test. We want to do an Allen test first to see if that artery is viable, right? So remember, we hold and then we tell them, we squeeze, we tell them to pump and then let go. Let go of one artery. If it fills up in the hand, that means that blood flow is good. So we're good. And then we do it again and then we hold. It's supposed to be pale. And then when we let go of the other one, if it flushes, it's good. So that's the Allen's test, okay? So arterial, so let's see, drawn with a heparinized, okay, let's see, keep on ice, temperature, what else can I ask you? Okay, so let's talk about the levels, okay? What should the levels be? What are we drawing? What are we looking at from the blood? pH. What's another one? CO2 and bicarbonate, and also O2, oxygen levels, right? So what should the pH be? 7.35 to 7.45. What should the CO2 be? 35 to 45. And what should the bicarbonate be? 22 to 28. That's right. Okay. So now let's go into the metabolic alkalosis. Okay. We said metabolic. So we remember respiratory and metabolic. It's either one of those. Acidosis or alkalosis, either one of those, right? So we remember when we're looking at the numbers, we always want to look at which one first. I mean, I don't know how you do it, but I always like to look at the acidosis first. I look at the pH first, so I can be like, okay, what is the body's state? It's alkalinic or it's acidic? And then I'm like, what caused it to do that? And I'm like, call the problem by its name, right? That's what I always say. So this one is metabolic alkalosis. So what's causing the problem? Well, what's the problem here? If it's alkalosis, then we say the body is what? Basic or acidic? Basic, okay. What is causing the problem? Increase of bicarbonate somehow. So it's a metabolism problem, right? Okay, so by definition, bicarbonate is excess. I'm looking at the arrow. I'm like, that's the wrong direction. Increase hydrogen. So excess bicarbonate, so it's more than which number? 28, right? It's more than 28. 26 or 28. So mine says 20. I say 26, but some books say 28. So I've seen 26 and I've seen 28. They're never gonna put it in between there. They're gonna put 30.
Okay, like 27.
Right? And even still, we know that it's coming from the alkalinic state. So even if it's within range, and they're like, what is the pH level? We could, if it says normal, we can say normal. But if it says alkalinic or basic, we're going to get it from whatever range it is in, okay? Okay, so let's talk about causes. What could cause metabolic alkalosis?
Anxiety.
Okay, yes, ingestion of baking soda. How anxiety?
Hyperventilation.
Yes, excreting the carbon dioxide so the basic stays high. You got it. What else?
Vomiting?
Oh, well, it is, but if the person, he's saying if the person is hyperventilating, then their possibility, you're right, they're right. They're right, because like if the respiratory is not causing the problem, then we're not gonna call it respiratory. But it does happen that way, where if we have bicarbonate issues, what the body's going to do is ask the respiratory to help it somehow, right? Okay, so going back, so we have vomiting is another one, right? So we want to stick to metabolic issues, metabolic things. So vomiting, no one mentioned suctioning, right? And then we have diuretic therapy is another reason as well. So what are we going to see? Tingling. So that's tetany. We're going to see tetany, muscle tone. We already mentioned the pH. Say it again. Right. So then that's where the shallow breathing is going to happen, right? So that's like a byproduct of that. So the shallow breathing. What are we going to do for interventions?
Make them breathe good.
So breathe through a paper. Okay, so kind of retain the CO2. Definitely. We can give them fluids to restore fluid volume. That would help wash out some of the basicity of the body. What else? Monitor potassium is another thing that we have to do. So the monitoring potassium, do you remember like the way the muscles work when like the action potential, all of that, like the cells, potassium, sodium pump, all of that. So that's where the potassium comes in, because hydrogen comes in and out, and somehow when hydrogen comes in and out, the potassium leaves too. So since we have a hydrogen issue, that's going to affect potassium. That's also the same thing with insulin. When you're giving insulin, you also have to watch potassium, because also hydrogen. But then it makes sense because of respiratory acidosis. Acidosis happens, so there's an H shifting happening. So potassium, you always watch it, right? When there's like a shift of acidosis, alkalosis happening somehow, okay? All right, so since we're monitoring potassium, if we need to give potassium, we're gonna do that, okay? So that's a metabolic acidosis. Let's see if I missed anything. Okay, moving on. How about respiratory acidosis? How do we define it? What is respiratory acidosis?
Not expelling the pH.
Right, not getting rid of the CO2, because the CO2 is the acid, okay? And what causes it? Hypoventilation. They're not, that's right. But what causes hypoventilation? Yes. Something that causes the respiratory to depress. Yes. Okay, so sedation. Okay, sedation. Pulmonary edema is another one. Okay, COPD. Yeah, that's a whole process there. Okay. So what are we going to see? The person has respiratory acidosis. It mentioned the levels. So we know the levels, right? So what? The CO2 is what? High or low? 35. It'll be higher, right? So 45 higher. The pH will be high or low? Low, because low pH is acidosis. So those are the main things that we care about, to be honest. Okay, so what are we gonna, so that's one of the things we're gonna see. We're gonna see the labs vary in that way. What other things are we gonna see with a person with respiratory acidosis? Also mental status, which is the neuro. So a person could be in a coma. This person could have weakness, restlessness. Okay, what else? Let's see. We could have tachypnea, dyspnea. A weight loss is another one. Okay, interventions. What will we do for them?
Depends on why they have it.
Sure. That's important, right?
If you're ODing on morphine, you reverse that.
Reverse that. Very good.
If you have COPD, reverse the breathing.
Yes, awesome. And since we said that if the person has a respiratory issue and it's broken, it can't help itself, the bicarbonate might help it. What could we do? If we have respiratory acidosis, we could give bicarbonate. Yeah, right? We pour some base in there and it sizzles. Neutralizes the thing, right? Yeah, we could definitely give bicarbonate per order. We're definitely going to promote good breathing techniques, right? What else? Administer bronchodilators. If we know that it's a closure, COPD maybe. What else? What could it? Maybe this mucus is blocking it and it can't get out, whatever. So we can fix that. So depending on what it is, we get help with that. Respiratory alkalosis. What's causing the problem? The lungs. What problem is it causing? Say it again. Yes, the lungs is causing the lungs are causing the body to become basic. Okay, so CO2 deficit, because CO2 is acid, but this is respiratory alkalosis. What are the levels? What are the numbers looking like? pH is high because that's basic alkalosis. CO2 is low because it's acid, but this is alkalosis, so it got to be low. Yes, gotcha.
Depending on if it's compensating, you see the bicarbonate.
Yeah, we could, yes. So we didn't mention like what the opposite thing will be doing, but we know if that number is changed, that means it's compensating. If it's not within its normal range, it's compensating. And obviously it's going to try to compensate in the direction that's going to help the problem.
So you see low bicarbonate.
But if we see the number is off, right? I remember in my class we had one where it's like respiratory metabolic alkalosis. Let's hope you never find one of those, right? But if it does, all we have to do is we remember the problem is whatever is agreeing with the pH, right? So if it agrees with the pH, then if it's both of them, if it's both the respiratory, both the lungs and the kidneys that are causing the pH to be acidic, that's why it's respiratory metabolic acidosis, right? But usually it's just one that's acting up and the other one is helping it. So it's the opposite. So it won't agree, usually, okay? So the causes, what causes respiratory alkalosis?
Pain.
Say it again?
Pain.
Pain, okay?
Anxiety.
Anxiety, pain, yes. Elevated body temperature is another one. Okay, manifestations, what are we gonna see? We can see tingling, we can see unconsciousness, and we'll see the numbers, how they vary. Interventions, what do we do?
They can breathe faster.
In that paper bag thing, bring back in the
CO2.
CO2. What else? To calm them down. It's true, if their anxiety is through the roof, we could. But if we don't want to depress it too low either, right? But we do monitor. Remember, guys, anytime you're giving anything, you always want to watch that it doesn't go to the other side. And I see that often when we do endocrine, right? Like the person have hypothyroidism, then they cut it out because it was hyper. They cut it out and now they're hypo, right? Whatever it is that you're doing, you don't want to go to the other side. So you always want to monitor. But yeah. Okay. And that's acidosis. Okay. Good timing.